Zimbabwe is one of the handful of African countries on track to surpass the 95-95-95 set targets by 2025. Although tremendous progress has been made in the fight against HIV and AIDS, the rate of new infections among children and adolescents and young people remains unacceptably high. The First Lady of the Republic of Zimbabwe, Her Excellency Dr. Auxilia Mnangagwa, has been a champion for health over the years and a health ambassador with a strong focus on the well-being of women and children and other vulnerable populations.
We can reduce the risk of HIV to the baby greatly by preventing HIV infection among women of childbearing age, preventing unplanned pregnancies among women living with HIV, providing care, support and treatment for women living with HIV, their partners and their families.
Recently in Mazoe district in central Zimbabwe, she interacted with pregnant and breastfeeding adolescents and young mothers living with HIV from the community. They shared their journeys and expressed their appreciation for the First Lady's commitment to uplifting lives.
Ini ndaive ndisina tarisiro kana fungidziro yekuti ndichazvara vana vari negative, ini ndiri kubva positive mandiri, asi ndakakwanisa kuzvara vana vangu 4 zvokuti vana vangu they are fit and strong. Even ini nyakamira vashoma vanotoziva ndiretenge ndataura inini kuti nditori positive.
She encouraged them to practice a healthy lifestyle, including adhering to their treatment for an HIV-free generation.
Ende vana baba ngavasaite undurani mumba, ngavadzidze kushandisa maprotection anga achitaurwa zvese zvangataura ngavabate zvechokwadi.
The First Lady built a nearby clinic that provides HIV testing and counseling services, including antiretroviral treatment. She is supporting the Ministry of Health and Childcare as an advocate and champion for ending AIDS in children through the Global Alliance campaign.
Kuti tisvike pakuti vana vedu avachisina AIDS pa 2030 tinenge tichishandisa atinoti 4 pillars dzakaitwa neGlobal Alliance. Chekutanga tinoda kuti vatestwe kuonekwa kuti havana utachiona here, uyezve vopiwa kurapwa kwakakwana. Chechipiri, vaya vasiri kurapwa vane pamiri nekuyamwisa vachirarama neutachiona vaiswe pachirongwa ichochi uyezve varambe vachitora mishonga yavo. Chechitatu, toda kudzivirira utachiona hutsva kuti husasvike kune vanoyamwisa nevane pamuviri madzimai edu.
Working alongside government, UN agencies and partners, she works in communities, especially among pregnant and breastfeeding young mothers and their babies, to prevent vertical transmission of HIV and syphilis. While in Mazoe, the First Lady also launched the We Are Equal campaign in Zimbabwe, a continent-wide initiative that aims to close the gender gap, including inequalities that impact access to universal health care and HIV services. The United Nations Resident Coordinator in Zimbabwe, Mr. Edward Kalon, commended the First Lady's efforts to improve the lives of adolescent girls and pregnant young women in accessing HIV treatment.
I would like to congratulate you on the launch of the We Are Equal campaign, especially since gender inequality is one of the key drivers of new HIV infections amongst adolescent girls and young women. The UN family, under the joint UN AIDS program, has supported the domestication of the Global Alliance to End AIDS in Zimbabwe, which resulted in an ambitious Zimbabwe Global Alliance plan that is guiding implementation towards ending AIDS in children and adolescents.
The First Lady is calling for the involvement of men and boys in eliminating the vertical transmission of HIV and syphilis in Zimbabwe.
I'm asking for role models among all of you men who are here to support me in implementing the We Are Equal campaign. I'm greatly concerned about teenage pregnancies, which is sitting at 22%. Child marriages are on the rise, and we must do all in our power to reverse this trend. We Are Equal, together we can.